Hello everyone, and welcome back to our channel. Today, we have an important topic to discuss. Hepatitis B. In this video, we will explore what hepatitis B is, its causes, symptoms, prevention, and available treatment options. So, let's dive right in. What is hepatitis B? Hepatitis B is a viral infection that primarily affects the liver. It is caused by the hepatitis B virus, HBV, and can lead to both acute and chronic liver disease. The virus is transmitted through contact with the blood or other body fluids of an infected person. History of hepatitis B. Hepatitis B has likely been present since ancient times, although its specific identification was not known. Historical records from ancient China, Egypt, and Greece describe symptoms that are consistent with hepatitis B infection. In 1965, Dr. Baruch S. Blumberg, an American physician and geneticist, discovered the hepatitis B virus, HBV antigen, later known as the Australia antigen. In 1981, the first plasma-derived hepatitis B vaccine was developed by Maurice Hilleman and his team. This vaccine, made from purified hepatitis B surface antigens, proved highly effective in preventing hepatitis B infection. In 1986, first commercial vaccine for hepatitis B was approved for public use. This vaccine, derived from recombinant DNA technology, was safer and more widely accessible than earlier plasma-derived versions of vaccines. In 1992, the World Health Organization, WHO, launched the Expanded Program on Immunization, EPI, to promote universal vaccination against hepatitis B. In 2002, the WHO set a global goal to eliminate hepatitis B as a public health threat by 2030. This target included a focus on prevention, diagnosis, treatment, and vaccination efforts. Structure of hepatitis B virus. The hepatitis B virus, HBV, is a small, enveloped virus with a unique structure. Here's a brief overview of the structure of the hepatitis B virus. Outer envelope. The HBV has an outer envelope made up of lipids. This envelope surrounds the inner core of the virus and is derived from the host cell membrane when the virus is released. Surface antigens, HBsAg. The outer envelope contains proteins known as surface antigens or HBsAg. These antigens play a crucial role in the virus's ability to attach to and enter host cells. Core capsid. Inside the envelope, there is a protein shell called the core capsid or nucleocapsid. The core capsid houses the viral genome and viral enzymes. It is composed of a single type of protein called the core protein or HBcAg. Viral genome. The HBV genome is composed of partially double-stranded circular DNA. It consists of 4 overlapping open reading frames, ORFs, that encode various viral proteins. Enzymes. The HBV genome encodes 3 important viral enzymes which include DNA polymerase, reverse transcriptase, and ribonuclease H. These enzymes are essential for viral replication and are involved in reverse transcription. How hepatitis B transmitted? Hepatitis B is transmitted through contact with the blood or other body fluids of an infected person. Here are the main routes of transmission. Sexual contact. Hepatitis B can be spread through unprotected sexual intercourse with an infected person, including vaginal, anal, or oral sex. It is important to note that even if there are no visible symptoms, the virus can still be transmitted. Direct blood contact. The virus can be transmitted through direct contact with infected blood. This can occur through sharing needles for injecting drugs, as well as through accidental exposure to infected blood in healthcare settings. Mother-to-child transmission. Pregnant women with hepatitis B can pass the virus to their babies during childbirth. Sharing personal items. Sharing personal items that may have come into contact with infected blood can lead to transmission. This includes items such as razors, toothbrushes, or any other items that may have traces of infected blood on them. Occupational exposure. Healthcare workers or individuals who come into contact with blood or body fluids in their profession may be at risk of acquiring hepatitis B if appropriate precautions are not taken. It's important to note that hepatitis B is not transmitted through casual contact like hugging, shaking hands, or sharing food or drinks. It primarily requires direct contact with infected blood or body fluids. Pathogenicity of the hepatitis B virus. Pathogenicity of HBV refers to its ability to cause disease and the mechanisms by which it affects the human body. Here's a brief overview of the pathogenicity of HBV. Entry and replication. HBV enters the body through contact with infected blood or other body fluids. Once inside, The virus primarily targets and attaches to specific receptors on the hepatocyte surface and enters the cell, where it replicates using the host cell's machinery. Viral proteins and immune response. During replication, HBV produces various viral proteins, including surface antigens, HBsAg, core antigens, HBcAg, which can trigger an immune response, leading to inflammation and damage to liver cells. Acute hepatitis B. During acute hepatitis B, the immune response can cause liver inflammation, hepatitis, resulting in symptoms such as fatigue, jaundice, abdominal pain, and nausea. Most people recover from acute hepatitis B within a few months. Chronic hepatitis B. Chronic infection occurs when the virus persists in the body for more than 6 months. Prolonged inflammation and liver damage can lead to fibrosis, cirrhosis, and an increased risk of liver cancer. What are the symptoms of hepatitis B? The symptoms of hepatitis B can vary from person to person, and some individuals may not experience any symptoms at all. However, when symptoms do occur, they can include fatigue. Feeling tired and lacking energy is a common symptom of hepatitis B. Jaundice. Jaundice is characterized by yellowing of the skin and eyes. It occurs when the liver is unable to process bilirubin, a yellow pigment produced from the breakdown of red blood cells. Dark urine. The urine may appear dark or brownish in color due to the presence of excess bilirubin. Other symptoms may include abdominal pain, nausea and vomiting, loss of appetite, joint or muscle pain, fever, pale stools and itchy skin. How to diagnose hepatitis B? The diagnosis of hepatitis B involves several steps and tests. Here is an overview of the diagnostic process. Medical history and physical examination. Healthcare provider will begin by taking a detailed medical history and will also conduct a physical examination to assess any signs of liver disease, such as jaundice or an enlarged liver. Hepatitis B surface antigen, HBsAg, test. This blood test detects the presence of HBV surface antigens, indicating current infection. Antibody, anti-HBs test. This test measures the presence of antibodies against HBV surface antigens. It is used to determine immunity after vaccination or recovery from a past infection. Liver function tests. These blood tests assess the overall health and function of the liver, including measuring liver enzyme levels such as alanine aminotransferase, ALT, and aspartate aminotransferase, AST. Elevated levels of these enzymes can indicate liver inflammation or damage. Additional tests. Depending on the specific circumstances, additional tests may be performed, such as liver imaging, ultrasound, CT scan, or MRI, to assess liver health, or a liver biopsy to evaluate the degree of liver damage or fibrosis. What is treatment for hepatitis B? Here's a brief overview of the treatment options for hepatitis B. Antiviral medications. Antiviral medications are often prescribed to individuals with chronic hepatitis B. These medications help suppress viral replication and reduce the risk of liver damage. Commonly used antiviral drugs include entecavir and tenofovir. Regular monitoring. Individuals undergoing treatment for hepatitis B will require regular monitoring, including blood tests to assess liver function, viral load, and other markers of liver health. Liver cancer screening. Chronic hepatitis B infection increases the risk of developing liver cancer. Regular screening, such as ultrasounds and alpha-fetoprotein, AFP, blood tests, may be recommended to detect any signs of liver cancer at an early stage. Lifestyle modifications. It include avoiding alcohol consumption, eating a healthy diet and avoiding hepatotoxic medications. How to prevent hepatitis B? Preventing hepatitis B infection primarily involves vaccination and adopting certain preventive measures. Here's a summary of the key strategies for preventing hepatitis B. Vaccination. The hepatitis B vaccine is highly effective in preventing hepatitis B infection. The vaccine is administered as a series of 3 or 4 shots. It is recommended for all infants, children, and adults, particularly those at high risk of exposure to hepatitis B virus. Safe sexual practices. Engaging in safe sexual practices can reduce the risk of hepatitis B transmission. This includes using barrier methods of contraception, such as condoms, and practicing monogamy. Avoid sharing needles and personal items. Avoid sharing needles, syringes, or any drug paraphernalia if injecting drugs. Additionally, do not share personal items that may come into contact with blood, such as razors, toothbrushes, or personal hygiene items. Use standard precautions in healthcare settings. Healthcare workers should strictly adhere to standard precautions, such as wearing PPE and other protective barriers when coming into contact with blood or body fluids. Ensure safe blood and medical products supply. Screening donated blood and blood products for hepatitis B is crucial to prevent transmission through blood transfusions or organ transplants. Prevent mother-to-child transmission. Pregnant women with hepatitis B can pass the infection to their newborns during childbirth. However, the risk of transmission can be significantly reduced through timely administering the hepatitis B vaccine and hepatitis B immune globulin, HBIG, to the newborn within 12 hours of birth. Be cautious when getting tattoos, piercings, or acupuncture. Ensure that sterile needles and equipment are used for procedures involving skin penetration, such as tattoos, piercings, or acupuncture. Conclusion. Remember, education and awareness are key to preventing and managing hepatitis B. By understanding the risks, symptoms, and available treatments, we can take proactive steps to protect ourselves and our loved ones. That's all for today's video on hepatitis B. If you found this information helpful, please give this video a thumbs up and share it with others who might benefit from it. Don't forget to subscribe to our channel for more health-related content. Thank you for watching, and until next time, stay healthy and stay informed.